Hello everyone, welcome back to this video. I'm your Dr. Tinyhuman. In this video, we'll be learning about the X-ray, the basic points of X-ray, that how do we need to identify and what are the components of an X-ray one by one, right? So first one is X-ray chest, that is position, the view, what we call, right? Anterior-posterior view or posterior-anterior view. Anterior-posterior view mostly taken in neonates when the baby is in supine position, sleeping position, where the rays are focused from anterior side to the posterior side, where a plate is placed over the posterior part of the abdomen, right? That is the back. Whereas in bigger babies are toddlers or adolescents, or even bigger babies, we can use PA view, posterior anterior view, where the focus is from posterior to anterior side and the plate is placed over the anterior side, right? There's the first one point, that is PA view. And the second one is exposure. Exposure means how well the X-rays are exposed, right? Well exposed X-ray means if the spinous process, the first four thoracic vertebrae are visible or not. On the basis of that, we will say whether it is exposure is good or not. And then we talk about the centralization, right? Well centralized means the medial ends, both the clavicles, so both medial ends of the clavicle are at equal distance from the spinous process and between the vertebra, right? They should be placed at equal distance. And the third point is the lung fields. They are basically divided into three zones, that the upper, middle, and the lower. The upper part is a portion above the second rib. The middle part is a portion between the second and the fourth rib. And lower part is a below the fourth rib, right? On the basis of that, they are classified as upper part, middle part, and lower part of the chest of the lungs. And what we need to look out in those lung fields. The first one is lucency and opacity of the equivalent position in both the lung fields, right? Okay. And then costophrenic angle. And then comes the cardiophrenic angle. And then comes the apical part, that is apices. And then the hilum. And the parahilar and the paratracheal opacities, whether the lymph nodes are enlarged or not on the basis of that. And then after lungs, we look for the heart. In heart, we look for the shape of the heart, whether it's cardiomegaly or not. And then size of the heart, normal, enlarged or small. Shape of the heart, and of course the CTR ratio, that is cardiothoracic ratio. It helps to differentiate whether there is cardiomegaly present or not. And then we will look for the ribs and spine. Fracture, erosion or bedding of the ribs are present in rickets. And visualization of abdomen, the gas center diaphragm, right? And if the presence of any calcified spots in soft tissue, suggesting of TB adenitis. If these are all the normal findings, which first of all we need to look for, to identify the abnormal things, first of all we should know what is normal. So it helps us to differentiate on the basis of the differential diagnosis, right, one by one. Thank you.